Hospitals face so many unique challenges compared to, say, someone in retail or oil and gas or IT or telecom, particularly in the fact that they're dealing with human lives, right? You're also serving a product that people typically don't want to buy. Nobody's out there shopping, hoping to buy healthcare services, right? It's something that happens to you, and now you're looking for someone who can deliver high quality, but it's not something that you're seeking out. So you're not competing in the same way as those organizations are, those types of industries are. But the biggest part is labor. It's skilled labor, it's people. It's doctors, nurses, techs, housekeeping, food service, pharmacy, all of those different organizations, and about 60% of the cost structure of the average hospital is labor, wages, and benefits. So understanding when you're trying to be an affordable healthcare provider at a high quality, what levers do you have to be affordable? Well, it's primarily in how well you use your assets and how well you use your labor. Business acumen in healthcare is incredibly important, as healthcare organizations are really mission driven. They're focusing on serving their community, creating a high quality patient experience. They've got providers that they need to take care of and attract. And so their focus isn't always necessarily on the business and finances quite as out front as some of those other priorities. But those healthcare organizations that can develop leaders to have a high degree of business and financial acumen are those that are going to really be able to separate themselves now and into the future. Sister Irene Krauss, who is the first head of the American Hospital, first female head of the American Hospital Association, coined the popular phrase, "no margin, no mission." And that's particularly relevant within healthcare, because driving margin dollars and being able to understand what levers leaders can pull to do that, relying on that business acumen, gives them an increased capability in furthering that mission. So it's incredibly important for provider organizations, healthcare providers, to see the gap that can exist in business acumen and take steps to close it. So in my experience working in healthcare providers, I worked for a large integrated delivery system in the Bay Area, running their continuous improvement program for about 5 years. And the leaders in healthcare are typically people who love the people that they serve, their own employees. They have a strong bias toward patient safety and patient quality, and they're really just the heart and soul of the organization. They're truly fearless. But oftentimes they're the only person who was courageous enough to leave the bedside and take on that challenge of leadership. And unfortunately, there's not a lot of people who are interested in stepping up and taking on that challenge. So they have so many individual competencies, but they're not trained in the business and financial side. They're clinical people who have stepped up to leadership. But in my experience working in those organizations, those leaders who were able to close that gap with business acumen and seeing both sides of the equation, so to speak, and being able to understand the interplay between safety, quality, the patient experience, and the financial results for running their particular part of the business, are those who are able to be seen as someone who gets it, so to speak. Oftentimes that's how I think about business acumen, is it's somebody who just kind of gets it. And those people are the ones who are tapped for a new and innovative project to lead it. And healthcare organizations that are able to develop that competency in their people, those are the ones who are going to stand out and win in the long run.